Building Block 6, Population Management, the 6 core steps to caring for patients with complex needs. Complex care management is a set of services designed to assist patients and their caregivers in managing medical conditions more effectively in the complex context of their lives. The aim of complex care management is to improve patients' health and well-being and reduce usage of avoidable, expensive medical services, which are indicators of inadequate care for patients with complex needs. We can think of overall population management as stratifying a population of patients based on their care needs and designing care that is tailored to those needs. Every person across a population needs basic preventive care, such as blood work or cancer screenings. Providing this care systematically and proactively using the team is called panel management. For the subgroup of patients with chronic conditions such as diabetes, health coaching may support them in improving their self-management. Complex care management targets services for a smaller group of patients with complex healthcare needs for whom the usual system of care is not meeting their needs. People with complex healthcare needs are not a distinct category of patients. They are the patients at the far end of a population-wide spectrum, ranging from healthy individuals to people with serious medical problems. Avoidable hospitalizations are often one symptom that the system is not working for them to keep them healthy. But there may be other signs that can be identified before they are hospitalized. These include having multiple chronic conditions, many medications, multiple providers, and limitations on their ability to perform basic daily functions. In addition to their physical conditions, such as congestive heart failure or diabetes, complex patients may have low health literacy, mental illness, substance abuse, homelessness or precarious housing, inadequate nutrition, or live below poverty level. The goal of complex care management is to improve people's health and ability to manage their conditions. When it is done well, complex care management has the added benefit of reducing costs to the healthcare system by avoiding unnecessary expensive services such as inpatient hospital stays. The goals of complex care management are to improve patients' functional health status, enhance coordination of care, eliminate duplication of services, reduce the need for high acuity medical services. Complex care management may be based in a variety of settings, such as primary care practices, IPAs, health plans, and hospitals. A complex care management team may meet with patients in clinic settings or hospitals, visit them at their home, or follow up with calls. Research suggests that there is a particular benefit to basing complex care management in the primary care practice to enable the complex care manager to coordinate closely with the patient's primary care provider. This requires protected time for the complex care manager. In a small practice setting, this could mean setting aside time for check-in calls for patients of concern or to conduct teach-back for a patient with inhalers. The team members involved in complex care management vary, depending on the setting and resources of a particular clinic, as well as the particular needs of the local patient population. In larger health centers, complex care management is done by a team led by an RN or social worker. Other team members may include behavioral health, pharmacists, physical or occupational therapists, medical assistants, and community health workers, health coaches, or patient navigators. This team coordinates with the patient's primary care provider. Complex care management in this model is high-intensity care, with caseloads usually of 50 or less patients per RN or social worker. A larger complex care management team with a health coach or patient navigator support may be able to support larger caseloads. In a small independent practice setting, complex care management might be led by an MA who is in charge of things such as calling patients between visits or when they are discharged from the hospital, ensuring that the practice has received visit summaries from the emergency department or specialist visits, and care management teams at larger IPAs may provide access to people such as an RN care manager or social worker. There are 6 steps to implementing a complex care management program. These are identifying patients to receive complex care management, contact the patient, meet with or call a patient and ask if he or she would be interested in being in the complex care management program. Make an assessment of the patient's main problems. This assessment is often not done all at one time, but it is done little by little as the complex care management team gets to know the patient. Make a care plan for the patient's main problems. This is also done little by little, starting with the problems that the patient identifies as the most important. Implement the care plan. This may involve a combination of face-to-face visits, phone calls, home visits, outreach visits to shelters, discussions with the primary care physician or mental health provider, and health coaching. Adjust the intensity of care management. If patients are improving, their care management intensity may be reduced. We will now discuss each step in greater detail. Each clinic needs to decide how patients will be identified. This involves risk stratifying patients and identifying those who will most benefit from additional attention. The simplest way to identify patients for complex care management is to ask the clinical team who they are concerned about, whether because of a health decline, limited social support, challenges to navigating the health system, or other reasons. Care teams are good at identifying not only people in current crisis, but those who may soon experience challenges. Data can also be used to identify patients for complex care management. For example, electronic medical record data may be used to create a list or registry of patients with multiple chronic conditions, multiple chronic medications, many care providers, which increases need for care coordination, comorbid mental health or substance use disorders. Data from the EMR or claims data may identify patients with frequent emergency room visits and hospitalizations. These are often signs that a patient has healthcare needs that are not being addressed. Some clinics use the above data to calculate a risk score to help stratify their patient population. This can also be used to create a registry that the clinic uses to track high-risk patients. When identifying patients for complex care management, it is also important to consider to whom complex care management should not be offered. These may be patients who are too healthy for complex care management, or patients who may be too sick to benefit from complex care management but may benefit from alternate services for their needs. Once appropriate patients are identified, the care team should introduce the patient to the complex care manager in a warm handoff whenever possible. It is helpful if the care team can describe a concrete challenge that the patient is facing, such as getting their prescriptions organized and how the complex care manager can help. A complex care management team member can meet with people who are interested and provide more information about the services that they can provide, how they communicate with the care team, and how to get in touch with them. When a warm handoff is not possible, it is advisable to have the care team introduce the idea to the patient. Similarly, in an independent practice association, a practice may do a warm handoff to centralized services from the IPA. Such a practice would identify the best workflow for communication between the practice and the IPA. For example, an MA dedicated to complex care management coordination could be the point person for warm handoffs. The complex care manager or team then assesses the patient's main needs. This assessment starts with the clinician and patient's perception of the issue, but often goes deeper to identify the underlying issues. For example, a clinician might refer a patient whose blood sugar is out of control. As the care manager explores the issue, she could discover that this results from misunderstanding of medication instructions, difficulty affording or acquiring medications, or that the medications are being taken consistently but just are not enough. Similarly, a complex care manager might receive a referral for someone for one condition, but discover that depression or unmet social needs are getting in the way of caring for that condition. A systematic assessment allows the complex care manager to identify and address such issues. The assessment is often done little by little as the complex care management team gets to know the patient. It should identify major contributors to the patient's health problems and care needs, such as physical health problems, mental health problems, understanding of medications, ability to navigate the health system or other services, transportation, housing needs, assistance with food, substance use, and ability to perform activities of daily living. Clinics may use an assessment form to assist complex care management team members in assessing patients. This can be made available in the patient's chart or EMR to facilitate communication with other team members and the patient's primary care clinician. Make a care plan for the patient's main problems. This also may be done little by little, starting with the problems that the patient identifies as the most important. This should be done with the patient, patient's family members or caregivers, and the primary care clinician. The care plan may span a large range of areas, including interventions to assist patients with monitoring symptoms by home visits and phone calls to see if a disease process is worsening or red flags in order to intervene prior to need for emergency department or hospital care. Coordination of care among primary care, specialty care, and ancillary services, including transition in and out of hospital. Helping patients organize their medications, helping patients organize their healthcare appointments, helping patients assess social services, helping patients fill their prescriptions, behavior change action plans on issues such as healthy eating, staying physically active, and medication adherence, assistance with coping, assisting patients in adjusting to physical limitations, teaching patients and families about their diseases and medications. Implementing the care plan can be conducted through face-to-face visits, phone calls, home visits, and discussions with the primary care physician or mental health provider. Studies suggest that the most effective programs use some face-to-face time to build relationships with patients. Complex care managers often report that home visits are particularly helpful because they can help sort through some bags of medications or see the contextual information about the challenges that people face in their daily lives. Health coaching skills are vital in any interaction to ensure that the patient and their caregivers are informed, active partners in their care. This requires assessing and building on what they know about their conditions, symptoms, and medications, as well as identifying their goals for care and their sources of motivation. The complex care management team tracks how each patient does over time and revises the care plan as needed. Reassessments over time guide the level of intensity of complex care management that each patient needs. Some complex care management teams use their assessment or complex patient registry data risk scores to assign levels of care to a patient that correlate with the frequency of check-ins. Highest needs patients may require check-ins multiple times a week, while lower intensity patients may need check-ins monthly or may reach out to the team for support as needed. Patients that no longer require complex care management may graduate from the program. Complex care management teams may have regular meetings with each other, with the primary care clinicians, and or with extended services that are not part of the core complex care management team to facilitate care coordination and revision of care plans for patients. The details of who is on the complex care management team, the process for identifying patients for complex care management, and the workflows for assessment and implementing care plans should be customized based on the particular resources a clinic has available and the particular needs of the clinic's high-risk patients. For example, a small clinic that is unable to hire an RN for complex care management may structure their complex care management program as a multidisciplinary weekly hour-long complex care huddle, where clinicians and clinic staff, such as front desk and medical assistants or patient navigators, meet to discuss high-needs patients identified by the clinicians and identify action steps for each team member. For small, independent practices beginning complex care management programs, one first step might be as simple as having an MA call patients after hospitalization to create follow-up appointments with the clinic. Depending on the resources of the clinic, this could expand into a workflow for reconciling medications and checking for concerning symptoms. Payment and funding for complex care management also differs between clinics and systems. Traditional fee-for-service payment systems do not support complex care management well, due to payment usually being restricted to face-to-face visits with clinicians and not supporting the work of extended team members or non-face-to-face formats. A clinic may find funding for complex care management programs from patient-centered medical home initiatives, pay-for-performance funding, or per-member, per-month initiatives from health plans. Some clinics may be part of capitation plans or accountable care organizations that incentivize complex care management programs to reduce healthcare costs. Health plans and payers may directly work with a clinic as well to arrange support for complex care management programs. Depending on how complex care management is funded in a clinic, this may affect the priorities and target population for the complex care management program as well. Complex care management involves a team-based care management approach to patients with complex healthcare needs in order to improve their health and ability to manage their conditions. When offered to patients who frequently use emergency department or hospital services, it may also reduce the cost of care if they are better supported in managing their conditions out of the hospital setting. While details in implementation vary clinic to clinic, the 6 core steps in this webinar can guide a clinic through the steps in building an individualized complex care management program.